Hi, sociology scholars. This is the Sociology of Pandemics. I'm Dr. Todd Ferguson at the University of Mary Hardin Baylor in Belton, Texas, and I'm collaborating with Josh Tom of Seattle Pacific University in Seattle, Washington. And we are living in such an interesting time that I thought it would be great to go over how can sociology as a field help us understand what we're living through during a pandemic. I first want to give a shout out to the Org Theory team. This is a website, online orgtheory.net, that is a blog about sociology, and particularly Fabio Rojas, um, who posted a blog about how can sociology help us to understand pandemics. So we're using some of that to structure how we're thinking. So I want to say we're citing him, we're citing Dr. Rojas, we're citing Org Theory. We didn't make this up on our own. We're using a collaboration of other scholars. So let's think about epidemics and pandemics. We hear these words a lot. So an epidemic, this is when a disease spreads rapidly in a large number of people in a given population within a short period of time. So it can be locally based. We've like the Ebola epidemic, but what we're living in is pandemic. And pandemic is when an epidemic starts occurring on a scale that crosses international boundaries. And so that's what we're seeing. The root word here is all. So pandemic is for everybody. It's when all countries are experiencing some type of disease. And that's what we're seeing with this novel coronavirus. So when we look at pandemics, we can look at it through a couple lenses. So first off is obviously biology. You can look at the cell structure. You can look at how it affects people biologically. You can also look at psychology, how people are personally experiencing the pandemic. How do they think about it? How do they react to it? What are the emotions that come up? How are they processing it? But what we're going to look, obviously, because we're sociologists, we're going to look at how sociology can look at pandemics. So the biological part, the psychological part, these are so important. So we're not diminishing them, but we're going to focus on sociology. And you can think about all three combined create this field of epidemiology, or the field of public health. It's really when the social sciences and the natural sciences talk to one another and start looking at community health. So the way I want to think about pandemics today is through a model of social structure. We can look at it through resources. What are the things and structures out in society that help people do what they need to do? We can think about culture. What are the rules of the game? What are the norms, the values? What's our language? We can also think about material culture, and not just immaterial culture, but the material objects that are made. And then demographics. How old are people? What's the gender ratio? What's the lifespan? What's the death rate? So we're going to think about social structure using those three nodes to help guide our conversation today. So let's start with resources. So resources. First off, we have to think about healthcare systems. What we've seen in this pandemic is that our healthcare systems are struggling with supplies, getting enough personal protection equipment. You might have seen on social media where people are volunteering to make or sew hospital masks. And we're also seeing that our supply chains are limited. So what happens when you need a certain cotton swab to do the COVID-19 test, but that cotton swab is made over in Germany and it's been infected, or the other country's been infected, and so you can't get that cotton swab. So our supply chains, how do we actually get the materials we need to make the items that we need to help combat this epidemic? And we can also think about healthcare system capacity. How many total beds do we have? How many doctors and nurses and physicians assistants do we have? Do we have enough? Do we have enough janitors to help disinfect everything? And so there is actually capacity for this. You might have heard that there are not enough ventilators to help people breathe. And so how do we ramp up production of ventilators? And you might have heard the phrase flatten the curve. And this is absolutely connected with the healthcare system capacity. So you can think about um, there is this straight line, this horizontal line, which is the healthcare system capacity. How many beds, how many ventilators, how many ICU doctors and nurses. And if no interventions happen, then a lot of people get infected all at once over a short amount of time, and it overwhelms the healthcare system. But if you take measures to prevent the pandemic, the same number of people actually get infected, but it's over a longer period of time. And so the healthcare system, the capacity can actually handle it. So this graphic um, is not mine. I do not take credit for it, but it's a really good GIF, or if you want to say GIF, there's the debate about that, about flattening the curve. So if you just treat it like the flu, a lot of people are going to be sick and it's going to overwhelm the healthcare system capacity. But if you practice social distancing, if you wash your hands, if you limit when you go home or when you stay away from home or you go out to go grocery shopping, then you can actually flatten the curve. And that's where that phrase comes from. So let's continue with resources. So we can also think about transportation systems because our societies are networked through roads and railway systems and airports. So we've seen with airports, we've seen flights canceled. You might have had your study abroad trip cancel. We also have screenings at airports, which create massive long lines because our airports were not set up to be medical centers. We can also think about international border shutdowns. What does that do with trade? What does that do with family life? If one side of the family lives on one border, or one side of the border, and the other lives on another side of the border, what does that do with work life? If you cross the border, especially maybe from Canada to the United States or Mexico to the United States to work, what does that do to your life? So a lot of cities have mass transit systems, subways, buses. And so how do you pack a lot of people and practice social distancing? So let's look at this picture. How do you practice social distancing when you're trying to get on a subway? It's really hard. And so mass transit systems are great for moving people around, but it's also great for spreading social disease. So, also with resources, we can think about communication systems. So, we need to talk with each other, we need to communicate with each other. So, what we've seen is that some countries have really strong public health networks among scholars. There might be a centralized public health system, and they're communicating with each other. Other countries have hodgepodge networks where they're a little bit more informal, and so the communication networks are not as strong. You can also think about the internet. I mean, we are all using the internet now to learn. Some of you might have already taken online classes. Some of you, this might be new. And so the internet now is a need. It's not just a want. You have to have the internet. And so we can ask questions. Who has access to the internet? When public libraries are shut down or when colleges are shut down, who has access to the internet? Internet monthly fees can be expensive. And so now we start looking at issues of poverty and access to a really needed resource. And then we can start looking at all the different ways that we are starting to connect for education. So you might have Zoomed with your professor, you might have been on Google Hangouts with friends. Then there's Canvas or Blackboard or Moodle, whatever learning management system you use. Um, and so we're learning that these are resources that we are using every day now to get our work done. So with resources, we can also think about social connections because resources are not just things, but they're also relationships. If you've studied Pierre Bourdieu, you can think about social capital. Um, so first off, the big question, how does the disease spread through social networks? What we're seeing a lot is that this disease is transmitted through people who are in close contact with each other, and that means family. So if someone in a household gets it, there's a really high chance of someone else getting it in the family. So you can start looking at social networks and how the disease is spread. We can also start looking at social isolation. What happens if you live in your apartment by yourself or your house by yourself and you don't have family with you? So social isolation can be true isolation. It's not like you're hunkering down with other people, but you're absolutely isolated. What we've also seen is the loss of third spaces. So a third space is not home and it's not work, it's a third space. So think of like a coffee shop or a bar. Think about a place where people gather socially. And these places have been shut down. So parks, restaurants to dine in, your local coffee shop, they've all been shut down. So how do you have social connections when we've lost our third spaces? So now we have home, and if you're in the medical community or an essential community, you may have work, or now it might be home and you might work from home if you're lucky to still have your job. And so we've lost these third spaces. And then what we're all trying to figure out is how do we maintain close social contact, even when we don't have physical closeness? And so, how do we maintain these relationships? How do we maintain family ties over FaceTime or Google Hangouts or Zoom during this time of social isolation? So, with resources, I mean, the biggest resource we're seeing is wealth. How much money people have, the assets they own. Do they have a house? Do they have cars? Um, and so, what we're seeing, especially in the United States, is wealthy people have greater access to healthcare. I put this in parentheses for the United States because other industrialized countries, every other industrialized country has universal healthcare. They don't tie healthcare to employment. And so, if you're lucky enough to have your job and keep it during this time, you can continue to have access to healthcare. But what happens when you lose your job because your company's laying people off because we're entering into a recession or depression? Well, in the United States, because we've connected healthcare to employment, um, people are losing healthcare. So we're seeing there's a healthcare gap. Also, wealthy people have enough savings to take time off from work. So if they don't have paid time off, what happens when your boss says, hey, we're not going to pay you for the next month because we don't have work for you to do? Wealthy people have a cushion. The sociologist Robert Putnam calls this social airbags, this idea when there's a crash, do you have something cushioning you? And then wealthy people are more likely to have jobs that allow them to work from home. So let's explore this idea further. So we can think about two different type of labor markets. There's the primary labor market, and this is where people have good benefits. They have paid time off, they have health insurance, they have the ability to work home and stay away from the contagion. Here the examples are software engineer, they can work on their computer at home, lawyers can work from home, accountants can, we professors can as well. But then you have what's called the secondary labor market. And here, these positions have less job security and they rarely have benefits. And so, either there's no way to do the work from home because they're laid off, or they must work because they're an essential employee. And so they're going to be exposed to the contagion. So, here you can think about janitors, all of your grocery store workers, restaurant workers, people who are getting food to us, people who are getting sanitation to us, garbage collectors. They can't do their work from home, so they have to be. They're going to be exposed, or other type of secondary labor market people or positions. They're just let go. So when a store closes, if it's a clothing store, they're let go. Of course, this ignores medical professionals. So usually physicians, nurses, these are primary labor market positions, but because they're medical positions, they're absolutely working and being exposed to the contagion. So continuing with resources, now we can start thinking about institutions. This in itself could be its own node when we think about social structure. So absolutely, but I put it under resources just to help out. So let's think about how major institutions are being affected by the COVID-19 virus. So we've seen major sports being suspended. There aren't basketball games or little league games. Um, it, so people don't have entertainment as much. Religious services are closed in person, and then churches are struggling on how do you have a service electronically. Schools go online. I mean, that's what you're experiencing right now. And so institutions are just moving from in person to digital, and that's a radical change. And then childcare and elder care are more difficult to find. If your childcare center closes down or your babysitter can't come over to your house, then what do you do with your children? Similarly with elder care. And so what happens if you're still working? Let's say you're a nurse and you're still going into the hospital and you don't have anyone to take care of your child. So what do you do? And that's a real struggle. Here's a picture of a priest who is learning how to film mass or the service on his iPhone. And so I show this picture because all these institutions are trying to figure out how do you have some sense of normality when everything is socially distanced, when everything is turned digitally. Okay, so we're going back to our social structure. We've covered resources. Let's move on to culture. So culture, I like a simple definition of culture. It's a way of life, but it also can be the knowledge, the values, the beliefs, the language that we pass down from generation to generation. So within culture, let's think about politics. So what we're seeing in this pandemic is that our political culture greatly affects how we react to the threat and how serious we take it. We take it. So poll after poll has been done, and I'm showing one from Pew Research, conducted March 10th through 16th. So this is already dated, and so things can change. But it's the percent who say the coronavirus outbreak is a major threat to, and then they list some things: the U.S. economy, the health of the U.S. population, day-to-day life in your community, your personal situation, or your personal health. Across the board, our political leanings, so if you're Republican or lean Republican, or if you're Democrat, lean Democrat, they impact how we interpret the pandemic. So culture here is showing that it's not just biology that's going on, but culture is actually shaping how people interpret the pandemic. So across the board, people who are Republican or lean Republican are less likely to say that the coronavirus outbreak is a major threat. Moving on with culture, we can think about language. Our language actually affects how we interpret the pandemic as well. So it's not only political culture. So what do we call it? Do we call it the scientific sounding COVID-19? Or do we call it the Chinese coronavirus? And so what we've seen is calling the virus the Chinese coronavirus or the Wuhan virus, or some other people have called it the Kung flu, has led to physical violence and racist attacks against people of Asian descent. So I want to show a video from NBC News about this.
Why do you keep calling this the Chinese virus? Why do you keep using this? A lot of people say it's racist.
It's not racist at all. No, not at all. It comes from China. That's why.
Words matter. Calling it that presents physical harm to the Asian American community. Medical experts and health experts agreed that the proper term is COVID-19 or a novel coronavirus. By using this term, it adds nothing to the scientific community, but causes harm to the Asian American community.
You've been very clear about who you think is to blame.
No, I don't think. I know where it came from. It comes from China.
The implication of using words like that is to suggest that somehow Chinese people as a whole are to blame, and legitimizes the American populace as a whole, or certain elements of it, to discriminate against Asian Americans. And when I say discriminate, I'm talking about physical harm, verbal abuse that people feel and actually experience. These aren't just semantics here that we're talking about. These are actual events that people are facing.
Would you condemn the fact
Say the term again.
A person at the White House used the term Kung flu.
My question is, do you think that's wrong? Kung flu. And do you think using the term Chinese virus, that puts Asian Americans at risk, that people might target that?
No, not at all. I think they probably would agree with it 100%. It comes from China.
Well, unfortunately, Asian Americans have faced discrimination, have faced these sorts of issues throughout our history in the United States. Americans have always been better because we are a diverse community, because we come from different backgrounds. And that is why words like this from the president and refusing to acknowledge the harm that this does to our community is so troubling.
Okay, so what we can see is that our linguistic culture affects actually racist patterns. So moving on with culture, there is also, we can think about a narrative. What's the story that we tell ourselves about the coronavirus? And so here we can get into scapegoating, excuse me. So when we scapegoat someone, we blame someone. So whom do we blame for the epidemic? So do we blame Asians? Do we blame Europeans, especially Italians? Do we blame a political culture, so Republicans or Democrats? And so as you're starting to look at the framing of this narrative of this pandemic, who is scapegoated? Who is blamed? So going back to our three-part social structure, resources, culture, let's move into demographics. So demographics, the makeup of a society in terms of age and gender and race and wealth. So we have to ask the question, who is most vulnerable to the epidemic? And then how is vulnerability socially distributed? So for instance, we're seeing that the elderly are vulnerable to this pandemic, and we've seen that in Italy. It hit Italy really hard because they have higher rates of older people, and what epidemiologists are predicting is that Florida in the United States is going to be hit hard as well because they have more elderly. We can also think about the homeless. So the homeless, so we can start looking at urban areas. Homeless people are particularly vulnerable to the coronavirus. And then the incarcerated. So we're starting to see outbreaks in prison systems because there is no social distancing in a correctional facility. And so I put the example here as United States because we have the highest rates of incarceration amongst any nation in the world. And then those with pre-existing medical conditions and the immunocompromised. So we have to ask ourselves, what are the demographic categories that are experiencing this pandemic at higher rates than other categories? So going back to our three-part structure, we've covered resources, we've covered culture, and we've covered demographics. So let's think about social change. What kind of long-term changes will result from this pandemic? What's going to happen? And of course, this is all speculation, but we as sociologists and sociology scholars, we have to start thinking about this. So we need to ask what industries will survive and which ones won't. And then if you survive, if this, not people survive, but if industries survive, how will they be transformed? What is education going to look like next fall, next year, in 10 years, based off of this pandemic? How are religious services going to be changed? How are malls and shopping centers going to be changed? And then how will this change how Americans think about healthcare reform? Should healthcare in the United States be tied to employment when a pandemic erases employment for a lot of people? And so will this change the narrative about having healthcare coverage that is not tied to having a job? And then how will this change how we relate to each other? How will social isolation and social distancing change in the future when that's over? Will long-term social isolation lead to increased community belonging on the other side of things? So these are questions. We don't have answers for them, but we definitely need to start thinking about them. So this has been Sociology of Pandemics. I appreciate you listening. I'm Dr. Todd Ferguson, and I'm collaborating with Dr. Josh Tom. And so, once again, a big thanks to the Org Theory team. We're not affiliated with them, but they absolutely helped structure our thinking. So, thank you very much, and I hope you stay well